Thank you very much for an outstanding presentation. I mean, you've really clearly summarised the situation. In fact, when I compare your presentation to the pantomime of the sham COVID inquiries that are currently taking place, I get quite angry. I mean, to my mind, you've established a clear case for immediate dismissal of the relevant politicians and officials from public life on grounds of gross incompetence. And I think also you've presented prima facie evidence for cases of fraud and also corporate manslaughter caused by culpable negligence that really should be referred to the police for investigation. My question is that a reasonable assessment on my part, or do you think I'm overreacting?
Well, I'm not a lawyer, so I can't say whether it would be possible to take the legal actions you're outlining. I really don't know. It would be perhaps good if we could. It would certainly make the point, wouldn't it? What I would say is, thinking of who if you like, was responsible for this, it's tempting to blame the politicians, and I know a lot of my colleagues tend to blame the politicians, mainly in the UK level and in Scotland, across the world. But I tend to sort of feel that the failure, if you like, was more with my colleagues, medical and scientific advisors, because politicians, they don't know they're not from a scientific background. They haven't been talking about responding to a pandemic for years and years and years. Medics have, certainly public health people have, and scientists have. They understand all of these things. They should have known better. Politicians, they could only take advice from the experts. And I really don't know why so many medics and scientists went along with this. And we can talk about that, but it's tempting to say, well, that might have been because there weren't many public health people actually involved at the highest level in responding to the pandemic in Scotland and England, and probably in the USA and other countries either. The CMO in Scotland and Jason Leach, clinical director, don't have any public health training that I'm aware of. No, certainly not specialist public health training. They won't have managed an outbreak in their lives. The same applies to Chris Whitty and Patrick Vallance, and probably most of the people on SAGE. The only person in the English team who had public health specialist training was Jenny Harris, Deputy CMO. But having said that, even if they weren't in those key positions, I think my colleagues in public health, and particularly the faculty of public health, that is, if you like, the Royal College, the influential body responsible for training and standards in the specialty, I don't know why they didn't speak up. They should have been speaking, saying this is not the right thing to do. So I tend to put more of the, I feel there's a failure more within the medical and scientific community, although I would also accept that the media drove a lot of this too. And wider society, a lot of people were very ready to do all of these things without any argument. So, in terms of blame, you need to disperse it. It's not just one set of individuals. But I'm very disappointed in my medical colleagues and my scientific colleagues. Let's put it that way.
Yeah, very interesting. The comparison that you gave between the original pandemic preparedness plan that we had compared to what actually happened. Considering that we, in the past, had spent a lot of time and effort and energy preparing these things, and they seem to be quite sensible. What's your view on why systematically, point by point, there was just complete and utter deviation from that? Because surely the first thing that would have taken place would have been, well, we've got these preparedness documents and advice, but we're just going to completely ignore them and do something completely different, not just on one aspect of it, but on the whole lot. So the other surprising thing is that these things almost came out of nowhere and made no sense. So with your background in the public health area, these things things seem to happen that came out of nowhere, but they can't possibly have come out of nowhere. They must have they must have been born out of somewhere.
Yeah.
So why did we deviate so much from what the common sense approach had been for many years in the past?
Yeah, it's a good question. Well, yeah, no one really knows, but I guess my ideas would be, firstly, that the governments and advisors weren't in February, March 2020, weren't honest in telling us that they thought at the time the virus was a man-made virus out of the Wuhan lab. Michael Gove was talking at the UK inquiry recently, and he said that. So at the time they were concerned this was a man-made virus. If that was the case and it had been changed substantially, then the chances of cross-reactivity from other common cold coronaviruses was arguably a bit less. So I think at the time they were probably thinking an awful lot of the population could be susceptible to this new virus. It's potentially so different. It's not a gradual mutation. In nature, this is, a manufactured virus with lots of changes. So lower levels of immunity in the population. So I think they probably thought this could have a very dramatic impact. At the time, China was telling us that the infection fatality rate was 3.4%. That would have been about 2.2 million people dead in the UK. So, a substantial impact, very, very substantial. The Chinese were also telling us that lockdown in Wuhan stopped the spread. And then, of course, we saw the pictures from Lombardy in northern Italy where the NHS was overwhelmed and it was pretty chaotic there. So they're terrified that would happen in the NHS in the UK. And if that happened, someone with a heart attack or a fractured femur wouldn't be able to get in. There'd be mortality from other causes, an alarm in the population. So I think they saw all this building up and they thought, we've got to assume that this is very serious, very high infection fatality rate and potentially low immunity in the population. And the Chinese are saying, lockdowns were effective, even though there's no evidence up to that point. But they thought, well, we should try it. And they were talking about a 3-week lockdown just to lower the transmission, protect the NHS. And I think that's how it started. But they weren't brave enough to stop it after 3 weeks. I think it was potentially justifiable, a 3-week lockdown, and then we were over the peak, and even these inflated cases and hospitalisations were beginning to come down. That was the point to lift it, but they didn't. They weren't strong enough to lift it. And no doubt they were being pressed by the mass media, and it just went on, and perhaps they weren't brave enough to say we've got to change tack here. That's how I would understand it, but my guess is as good as no better than yours, really. There's all sorts of sort of societal and group processes going on.
My background's NHS strategic planning management for Ayrshire and Health Board and for a number of other health boards in terms of service development. So I've got a trained background from Manchester University by the NHS in public health management and experience of dealing with the AIDS, HIV epidemic, Salford as community unit administrator there. So when this thing came along, I kind of looked at the evidence and then I thought, I've had this disease already. Because I had, and my whole family caught it. We actually had a visitor from America, from the USA, who works on an American military base. She's a journalist there. And she came to us stay with us in Christmas, New Year 2019, and she came with the illness, and we all got a bit sick. And we didn't think very much of it because there wasn't an identified illness at that time. And when we talked to a lot of other people had it. So my first question, there's two questions, but my first question is, why didn't our public health surveillance pick this illness up well earlier? I've got a suspicion there was a military secret because the military games, the World Military Games were held in Wuhan. And I think a lot of people picked it up at that point, but they were young, healthy people. So they came back with mysterious flu-like symptoms. But first of all, it was the end of the summer. so they had natural seasonal resistance anyway. And then there was that kind of military aspect. So I think it was picked up by American military agencies as a possible bioweapon.
Yeah.
But then that wasn't released to public health authorities because of that security aspect of it. That's my possible theory. It's a conspiracy theory, but it's not an unreasonable one. The next point, so that's my first question really, what didn't surveillance pick it up? Because certainly we had all the right symptoms at Christmas 2019. And the second point really was this, it's about the public health culture in Scotland and in the UK, which in my view as a manager, it's a well-staffed establishment, but they are tending to be very complacent, very well fed, very well paid, and lacking in the ability to challenge the politicians in the same way as public health physicians do in other countries like America. I'll give you an anecdote about that. I was working for South East Thames Regional Health Authority. I had a good friend there who was a public health consultant for the Regional Health Authority back in this would have been probably the late 80s.
Yes, I remember. Yes.
And he'd gone off to America for a conference there, and the anecdote he had was he'd just been fired from his job as a public health consultant in Britain, which is very unusual at that point, extremely unusual for speaking out. And so he was outraged. So he was saying to his American colleagues in public health, I've just been fired. And they said, well, so what? And so his American friend looked around the room and said, how many of you have been fired? And they all put their hands up. We've all been fired. So the American culture is, much more kind of, public health consultants actually they don't care being fired. They want to speak out the truth. And I thought this is really, really curious cultural comparison with Scotland, where everybody tends to be very meek and mild and, compliant, I think.
Yeah.
So that's my next question, really. Why is public health so compliant and not a bit more political, a bit more, go for it?
Yeah. Interesting. First question, why wasn't it picked up earlier? I think that's probably because it was the winter, lots of viruses going around, a lot of overlapping symptoms between SARS-CoV-2 and lots of other viruses, flu, rhinovirus, adenovirus, coronaviruses that cause common colds. So unless it takes a while for a slightly different mix of symptoms to be recognised and then to develop a test for it to show what the causative organism is. And I suspect, so we didn't recognise it, and we don't routinely test for viral illnesses. Most people who come into hospital with flu, they don't, many of them do not, certainly in the community, in primary care, they don't have a test to identify the presence of influenza A. It's a clinical diagnosis based on the symptoms, so there's no test. So you only test, in training in medical school, you're taught only to test if it will change the management of the patient. Otherwise, the test is a waste of money and time. So there's not a lot of testing of viral illnesses in the winter unless you think something odd is going on. And maybe it just took a while for the penny to drop.
And because we didn't see a doctor, we just treated it like a normal
of course.
And just got on with our lives.
But I'm sure you're right, you did pick it up then. And certainly there's been retrospective isolates of SARS-CoV-2 all over the world before 2020. It was in the sewer in September 2019, picked up and it was Brazil. So, it was around, but it wasn't recognised and it wasn't tested for. And maybe it didn't get into the very vulnerable population. It took a while to get into older people where the mortality might have been picked up. Public health, why are they so meek in Scotland? Well, having worked both in England and Scotland, I don't think there's much difference, perfectly honest. But maybe they're meek in England as well. When I entered training in '84, public health training, a big thing was made about the independence of public health and how you would speak truth to power, and if necessary you would go direct to the health board and past the chief executive and everyone else if you felt strongly. I didn't see that happen all that much, but there were a lot of public health consultants who were contrary, if you like, and took different approaches and challenged their colleagues and their certainly clinical colleagues. So you may be right. Maybe we're more deferential to authority than they are in the USA. but certainly through the COVID pandemic, public health has been terribly meek. And I was horrified that we have a major public health emergency here, and I haven't heard the Faculty of Public Health make one pronouncement about this. The faculty, knowing what if they agreed with my sort of what I've presented today, my conclusions, and some of them will do, not all of them perhaps, but some of them will do, why weren't they speaking up about this? Why weren't they talking to the Prime Minister? Why weren't they talking to the news, the media if need be, and raising their concerns and making sure there was an open debate? But they didn't, and I was very disappointed by that. And when you see the excess mortality double the level in Sweden, there are a lot of people who have died because there wasn't that challenge, and we're continuing to see excess mortality, which I'm sure is caused by some lockdown deaths, some vaccine deaths, but they're the likely candidates. So it was a failure of public health. I certainly would agree with that, and very disappointing to see. But not just in the UK, and we didn't hear an awful lot in the USA, which you mentioned. Jay Bhattacharya spoke out, Martin Kulldorff spoke out, two of the signatories or the initiators of the Great Barrington Declaration, but a lot of other people in America were quiet, and CDC drove a lot of this.
Differences between some states. So some states
There were
much more relaxed,
yes.
And that's great because we can see the same comparisons there as
Yes.
here in Europe as well.
There were.
So it's great that some states had that authority, that autonomy, whereas in the UK, none of the countries took a different line really at all.
No, you're dead right. Ladapo, the chief medical officer in Florida, has spoken out and been very firm. So that, yes, there are some others speaking out, but there weren't enough.
Thanks, Alan. That was an excellent presentation. I could probably speak to you for days on this because, let's face it, the whole COVID pandemic is a bit like a Scandi Noir series where there's so many things going on. Need to try and work it all out. I'll try and keep my questions as concise as possible and wrap them up into one question. What happened to flu? Is it true that the virus has never been isolated? And what about the science? And I don't mean your science, I mean the science. Okay,
what happened to flu? It's a good question. It's possible that this test was the PCR test was reacting to flu, and therefore we were counting flu as if it was SARS-CoV-2. It's possible that we don't normally do a lot of testing for flu. So we count flu in the winter, but the traditional approach we use, there's two approaches. One is we have a network of GP spotter practices, they're called. So they report symptoms, patients with a symptom complex, which is thought to be flu, and they just count those, they don't test. And the other is lab tests, and that mainly comes from patients hospitalised. So we do some testing for flu, but there were lower levels of that. And whether there was some competition between the viruses, between SARS-CoV-2 and flu, I don't know, but there was an apparent lower level of flu, which others have commented upon, and it's not my specialist area, so I would defer to others, but it's not clear what happened really. So that's the first question. Viral isolation. The virus the genome has been sequenced, so we know the genetic. Sorry? Well, it was
in silico.
In
Silico.
It's a computer model.
Well, the Chinese told us that they had sequenced the
Chinese put it in silico.
genome.
On a computer.
Well, you know more than I do. I thought that it had been
A lot more.
had been sequenced, but maybe not. I think they haven't been able to grow it, to culture it. And some viruses are hard to culture, it's my understanding. I'm not a microbiologist. I defer to you if you are. But they're hard to culture. But I think the structure of the virus is known about. You know, the envelope, the spike proteins, and the RNA inside. So we know quite a bit about it, and there are, as I understand it, in the genome, there are some signs there that it's man-made. But virus isolation, I think presumably you mean by culture. That is hard to do for many viruses, and I think you're right, it hasn't been cultured as such. The science, I don't think there's anything called the science. That was a figment of the politician's imagination. Science is ever-changing, and science is simply the development of a hypothesis, the latest hypothesis, and then experimentation to test that hypothesis. And that hypothesis or theory lasts only as long, and really until the next one comes along which fits the data better. So science is always changing, and science is in flux, and you get different opinions. And as you've seen today, I have a very different opinion about many of the scientific aspects of this pandemic compared to Chris Whitty, for example. So there is nothing, I don't think, called the science. It's a figment.
Hiya. Sorry, I've not really got a question, but I have and I haven't. Thanks very much for your speech, and thank you, because you're a doctor, you've been questioning the data. I totally respect that and appreciate that, because I'm a data analyst. I've been looking at the data for the last 3 years. You're right, the flu fucked off in 2020. There was no such thing as the flu in the data within the UK or NHS or the government. But what I wanted to say is everybody's asking, why is there censorship? Why was there no informed consent? If anybody here doesn't already know, we're in the midst of a global genocide. It's all in the WHO documentation, the 4th Industrial Revolution, we've got an Agenda 2021, we've got Event 201, we've got all the documents out there that there is a depopulation globally that's been happening, which is why there's not been any informed consent, which is why NHS hasn't been following their principles, their key principles, and that's just where I'm at. And also AIDS, Ebola, COVID-19, they've got a patent now. Why are we patenting a virus? A natural virus should not have a patent on it.
Because it doesn't appear in nature.
Yeah, because it's man-made. And I think we're in the middle now of the real pandemic. When you're looking at that data, going back to the data, going back to the mortality rates,
Yeah.
I'm seeing, right, not one person did I know, apart from us, we did contract, I think it was like COVID in 2021, but in 2020, I didn't know anybody that had it, I didn't know anybody that died, and I've got a huge network, I work in a massive corporation, I've got a huge network of friends, family, not one person. I'll see this last 6 months, this last 3 weeks alone, the amount of deaths, the amount of fucking, it's disgusting, heart attacks, cancer's up 600 odd %. That was the last time I looked at the data, and the last time I looked at the data was like 3-4 months ago. And I think it's just, and they're getting away with it because they can't say it's vaccine related if people are just suddenly getting, my wee friend, 33-year-old, her cancer came back after when she was 6-year-old. She's been free for cancer her whole life, 3 vaccinations, and then suddenly it's come back and chemo's not working. Older generation, they're all just cancer coming back, heart attack, heart attack, heart attack. It's unbelievable how many funerals I've been in this last 6 months alone.
This is the excess mortality, and
this is
certainly
a pandemic, and they're shutting their eyes and they're not telling the mainstream population what's going on really.
Yeah, there's a number of oncologists have said they're seeing, just as you say, cancers come back, which had been very stable under control, and there is a reason for that. The sort of repeated injections in the boosters eventually stimulates an immunoglobulin which actually suppresses the immune system, IgG4, and that reduces your ability to counteract infections, but also reduces your ability to actually remove cancerous cells. So that's thought to be the mechanism.
Spike protein acts like a
Yeah. That's been observed by a number of clinicians.
Still safe and effective. Come and get your booster.
Yeah,
Okay?
yeah,
It's just like,
exactly.
This is the pandemic we're in. Like, we need to wake up. It's just frustrating again because you can.
Yeah, thank you very much, Alan. That was really informative, and you put it across so well because it's quite complex. You mentioned, no, first of all, there's a really good quote from a guy called Upton Sinclair, and I use it quite often, unfortunately. It's very difficult to get a man to understand when his salary depends on him not understanding.
Yes, I've heard that one.
It's exactly like what the last couple of speakers have said about the bigger picture that's going on and the financial picture. And I think we all in this room know that's why ivermectin wasn't taken forward. But my question is, I didn't even realise the NHS had a contact tracing app till quite late on, but I'd been using Tim Spector's app, who's an epidemiologist like yourself, the Zoe app, and they believed at the end of it, or their data showed, it wasn't a belief, the data showed that there was a correlation between poor microbiome and the severity of COVID. What are your thoughts on that? And the other thing was, you mentioned Boris Johnson's obesity. I don't understand why people who are obese have got comorbidities. They probably have poor microbiome. They're saying that the microbiome will be the next thing that pharma companies are bringing out instead of antibiotics.
Yeah.
So why don't we just have a big campaign on getting people to the right weight? So that's two questions. It's a public health issue. And if we're going to have, I mean, I've been looking at my microbiome because I refuse to take the injections, and I'm asthmatic and I get bad colds, and it's COVID. I think I had it, but I wasn't sure, a bit like the gentleman said before. So those are my two questions.
Right. Well, the first one is very easy to answer because I know virtually nothing about the microbiome. So I don't know, and I haven't seen any data about linking the microbiome to the severity of COVID-19, so I don't know. I know, of Tim Spector and the Zoe app that he has sort of advertised and used and produced, particularly early on in the pandemic, some useful data. So it would be interesting if he's shown that association, if further studies confirm that, and see what comes of that. Obesity, well, the answer to that, I guess, is that public health has been trying to do what you say for decades and decades and decades. And we haven't been all that successful. And I come to, there's an obesity epidemic, which is driving a diabetes epidemic, which is driving, a sort of cardiovascular disease and other disease problems. So it's a major problem. And I think maybe it's partly because we in public health have, I'm very critical of public health, aren't I? You can do that when you're retired. Because we pushed, in giving advice about a healthy diet, we said what you should eat, fruit and high quality protein and maybe less salt. And we said you can fill up on carbohydrates. I think that was a mistake. We eat too much carbohydrate. Well, I think that's what the plate model said. You can fill up on carbohydrate, particularly if it's wholemeal carbohydrate. Good for you. But all carbohydrate is even complex carbohydrates are broken down in the body to glucose, and glucose drives insulin intolerance, and that's I think resulted in the obesity epidemic, and it's not good for your insulin function, and it helps to generate diabetes. So I think we haven't helped that, but I think we do need to change to emphasize far more, be very careful with the carbs. The saturated fat is don't worry about that quite so much. We used to go on about that a lot. Saturated fat, you can have some of that, but watch your carbs particularly.
The cost of obesity in Scotland is about 5 billion, and
Yeah.
it's millions and millions of pounds for diabetes.
Yeah.
But if you got rid of ultra-processed food, not only would you help climate change, you would help
Yeah.
obesity.
You're dead right. And diabetes consumes about 10% of the total NHS resources. It causes huge problems. And it's not just the diabetes itself, the diabetes management, but it's the cardiovascular disease, the cataracts, the renal problems it causes, neural problems, amputation, yeah, vascular problems. Yeah. So, yeah, it's a big, big problem, yeah.
Kind of, thanks very much. That was a really good talk. And I kind of don't really know where to start. There's so much I could say about COVID. I've been studying kind of stats and stuff since the beginning. And I'd stopped actually looking at the stats because it was driving me mad. But up until the end of February this year, I can give you a count of people that had COVID, that had apparently died of COVID, that didn't have comorbidities. It was 1,112. So that's quite a lot less than 12,000. So just to put that out there.
Yeah.
Anyway, so I guess my is kind of on the psychological aspect of this. As I say, there's so many directions I could go with this, but I guess what my worry is that for me, this was definitely an experiment from the outset. My background and stuff that I've studied before. And I thought, well, this is absolutely a human experiment. And so I'm going to be part of the control group and not take this clot shot. My God, I'm so thankful I did. Unfortunately, I lost my mother, who would have been 90 tomorrow. But anyway, let's not go there. So my question kind of is, my worry is that with all this COVID inquiry stuff, it's a pantomime. The whole thing is a pantomime. Just about every time you pick up a paper or read the news, or listen to the news, it's a pantomime. Yeah. It's like a bad diet served up to you every single day. So my worry is that this COVID inquiry is just a whitewash. We're never going to find out what's really happened. People are going to pick out bits in there that relates to them, that they can get emotional about or whatever. We're never going to get the truth. And my big worry is, as was mentioned about the WHO stuff coming down the line, thank God some countries are saying, I'm not going to swear, but my worry is that what's going to come out of this COVID farce, pantomime season has already started basically, is that, oh, well, we couldn't really cope with it, so let's just hand everything over to the World Health Organization, the big boys and the WHO that's going to look after us because they've only got their best interests at heart. And I'm so worried that people, because they've taken this crap, people have taken a vaccine, an untested vaccine that didn't have any indemnity. Hello? Do you know what I mean? It worries me what people are going to take just so that they're not called difficult or because they want to be kind and, you know, all this. And as I say, you talk about the science, but science is questioned. It's robust. It has to be ripped apart. Otherwise, it's not science. That's why we have journals, because clinicians argue with each other constantly in journals, as you say, when new information comes up. So I guess my question is this. How much do you think, kind of the way I'm thinking, that this is a trial run for something bigger? And this is leading nicely into what's coming up next spring or whatever it is, when they have to make a decision about the WHO, and they'll take full control, and a lot of people will just hand it over. And another election year. So I think that this is an absolute pivotal point in humanity. This has been a test. This has been a wake-up call for people. And we could absolutely wake up from this. We can wake people up if we really try, if we really believe in the greater humanity and things like that. So I've rambled on. But yeah, just I wonder, are you thinking like me? Perhaps is anybody else thinking that this is a trial run? This is another. We've been fooled again. We're constantly fooled. We're never told what's happening. What we see is just a series of things that lead into one another, that fall into steps, because there's a greater plan. And there's people that, we talk about the World Economic Forum, but then there's people that are apparently
behind that we don't know. They'll be puppets of other puppets. This is massive. This is about the suppression of humanity. And, you know, you can go on and on about other things, about other aspects that are just plain evil. I don't want to because it's not nice. Yeah. But I guess that's what I'm asking. Is anybody else thinking that we really have to wake people up and say we're not the who? I agree with you. And it'll be all, because it's all for your own good and it's all happy clappy and, you know, like it is in Holland. Everything's so convenient, isn't it? Great. No, it's not, because we ain't having it. So that's what I say. I'm not having any of this. You know, I've lost someone close to me. I'm glad, as I say, I took the decision not to take it, and I'm glad I have. And I've seen people that haven't taken it and they're no longer here. Or do you know what I mean? So anyway, so my question is kind of leading into the WHO stuff.
Well, could I respond to that? Yeah, I have an awful lot of sympathy for what you say. And I agree, the UK and the Scottish COVID inquiries, I'm not hopeful they're going to produce anything very useful. They seem to be more interested in political tittle-tattle than getting to the real questions. I think the way they've been set up is almost designed not to address the real issues. It seems to me that the issue about how best to respond to a pandemic of an infectious disease needs medical and scientific input. It should be chaired by a medic or a scientist, you know, with a lot of other people of relevant skills on the group, and not, you know, a judge with you know, a team of lawyers and KCs. That goes down a sort of blame game, adversarial approach. It should be a typical scientific approach. We want to work together and collaborate to see if we can understand what was going on and how next time we can do it better. So I think the whole way they were set up was wrong. And I think the terms of reference, the terms of reference of both the UK and Scottish inquiries, they only mention evidence once. And when they mention it, it's not evidence as an evidence-based medicine. It's evidence as an opinion that's presented in a court of law. So there's no real push to look at the evidence and data. So I'm not hopeful. Certainly the WHO during the pandemic did not perform well, to say the least. They were chopping and changing about so many things. So they didn't give clear leadership at all. And I think they were just part of the overreaction. They didn't help to steer us towards a more appropriate response to the pandemic. So I have absolutely no confidence in the WHO, and giving them even more powers, it would be absolutely awful. That will make things an awful lot worse come the next pandemic. And I think you're right that, I mean, obviously, you know, medicine and public health is my area, but I'm aware that there are similar things going on or have been going on in other areas, and the things which I was talking about the censorship and lack of an open debate around the pandemic. Well, exactly the same thing has been happening around net zero and climate change. And there's not a scientific consensus for climate change. And I think the evidence of that is the World Climate Declaration, a bit like the Great Barrington Declaration for the pandemic, but a World Climate Declaration of 1,200 climate scientists who say that there is no climate emergency and net zero is not a sensible policy. So, but this has been submerged, that's been censored and pushed to the side. So there is a broader thing going on, I think you're right.
Why were public health officials so passive, so meek? And here's the strange thing, that this is the observation I'm making. As a society, we seem to be more combative than ever. You know, you say the wrong thing and you get 1,000 people on you. They don't mind tweeting and you have big placards and conflict, you lose your job or whatever. They're on your case right away. And yet with this, all these people there, nothing to say. And I'm wondering then if the issue isn't, although the point you made, Fiona, I think is a very valid one, you know, people's salaries on the line. But there is such a thing as moral courage. And, you know, everyone's got a limit. You know, they say everyone's got a price, which is true, but everyone's also got, surely, a moral limit. There is such a thing as moral courage. We've all got that. Where was that moral courage? And I'm wondering, to address your point again, in the end, The real thing is a lack of spiritual awareness. There's something deep inside, perhaps rotten in all of us. I'm not talking about public health officials. It applies to all of us. We were lacking that courage. And we're never really thinking that we're ever going to stand before God or your gods or whatever you believe in and account for your cowardice, when all you had to say was a word. You know, and in the end, everything that you do in your life, all your jobs and your salaries and promotions, they count for nothing against the love of your family, your children, your respect in the community. And we don't really seem to care about that. It's like, you say the wrong thing, they're on your case, but here somehow you don't want to say anything. Anyway, sorry.
Where do I start with it all? I've got so many things running through my head. But one of the things was about the control group. That in the beginning, the unvaccinated control group, they've now been vaccinated, which was quite a concern to me to think, well, why you want long-term studies in comparison? Why would they be given that? That was quite shocking to me. And health education, health promotion, as you were saying in the beginning, having been a nurse, and many years ago, for my sins, I used to be a vaccinator, so I'm speaking from somebody who would never dare now, ever, because it's all about, well, it should have been in my first training that I did 40 odd years ago about research-based and, you know, evidence-based, and none of that was done, you know, over this period as far as I'm concerned. Also, when I used to do immunisations, we would take a history, we'd make sure if there was any allergies, how they presented on that day, etc., etc. And none of that again was done. And speaking to colleagues, and I was told just don't be saying that and things. So I'm glad to get out the NHS because I'm quite ashamed. And what else was going to say? So the microbiome and things like that, we were encouraged to go and eat out and drink alcohol, not go to the gym, not get vitamin D from the sun, not, you know, all these things. To me, when you're talking public health, is the opposite of what people were encouraged to do. And in terms of even mental health. And I think that the increase in deaths and everything, you know, there's this wee whitewash about, it was because you didn't go and get your routine checks or various different things. Well, why would a population of say 20 to 40-year-olds be suddenly coming with cancers and things like that? That's unheard of, and it needs to be addressed. And of course, it's not. There's lots of other things I would say, but if I've got a question, what would you say to somebody who was still on the sort of wall of what to do, even in terms of, because it came across a wee bit like it's still okay to have a vaccine, whereas I personally, I don't agree with any of it, because I still don't feel we have all the facts about it, and it's still being hidden. So I wouldn't even be saying anybody should, even an 8 to 5-year-old, I'd be saying get your vitamin D and all these things and what have you. But anyway, I just wondered.
So what's my opinion on that now?
Yes.
Well, I didn't have the vaccine either, so my opinion was that you know, if you're fit and healthy and certainly around about 60 or below, you shouldn't have it. I think probably if you take high dose vitamin D, you get a better impact. Having said that, it's possible that the vaccine with the Wuhan variant and the Alpha variant, which were more severe diseases, it may have had a beneficial impact in reducing severe disease. We don't know for sure, it may have. But I at the time, I wouldn't have given it to anyone below 60 if they were healthy, certainly. Now, I think it should probably be withdrawn, because I think the boosters, there's lots of evidence that the boosters have very negative impacts. And I think even in the elderly, I think it's probably increasing their risks. So I think it should be withdrawn now. But I think it's less certain whether it had beneficial effects or not early on in the most vulnerable. But certainly rolling it out to the whole of the population was an extremely bad idea, extremely bad. And I think giving it to anyone now is a bad idea. I think it should be withdrawn. And you're right that virtually everything we told people to do during the pandemic was bad for their health. Stay inside, out of the sun, you'll generate less vitamin D. Stay away from your friends. Social contact is good for your mental health, good for your health generally. Going outside and exercising is good for your health. We stopped them doing that. And most of the decisions and most of the things we told people to do in the pandemic was bad for their health. Masks, I think, were bad for their health. It generated fear in the population. There's some evidence that it leads to worse disease. You sort of get the virus drying on the mask, and then you breathe it in, deeply into the lungs.
And increases acidity in the blood, which cancer seems to thrive on.
Right, and certainly that the sort of the fear which was generated in the population was extremely bad for the population. It should have been the reverse. It should have been a sort of calming, sort of containment of the population's anxiety. That's what we should have aimed for, not alarming them. That was extremely bad idea.
I'd like to thank you for your talk. Like Rose, I'm an ex-nurse. I stepped out of the NHS in 2014 for a great many reasons, but lots of protocols I was questioning. And I'm glad I did, because I wouldn't have lasted 5 minutes at the beginning of this so-called pandemic, because I don't believe there was a pandemic. Now, I think we could go all round the houses about the masks, about the social distancing, we could talk about all these things, but I feel we're missing the fundamental point that a group of us, paramedics, doctors and nurses, mid-2020, we sent freedom of information requests to the Scottish Government, the UK Government and 3 of the health boards about the isolation of SARS-CoV-2, the alleged novel coronavirus. Okay, and I'm sorry if I'm sounding sarcastic, because I feel I've just talked about this for 3 years and I'm so fed up with it. Basically, they all came back and said it had not been isolated, purified, sequenced or classified. Now, further investigation from some of the microbiologists said it is chimeric and it is computer generated. So my point is to bring this whole house of cards down, or to at least kind of awaken people. We need to let people know that there was no virus. There is no virus, and in actual fact, no virus ever has been isolated. And I'm talking about AIDS, I'm talking about Ebola, I'm talking about any virus. So I've had to do a huge, I was told a pack of lies basically in my degree, and I can live with that. But I think we have to look at terrain far more than contagion. To me, contagion is a myth. I believe that if you've got a cold, you're going to pass it on to someone, or someone can give you this. My head is bursting when people talk like that. I'm sorry, but I've just come full circle on that.
Said too,
So,
Pasteur said at his deathbed,
yeah.
the environment is everything. Latourette said too.
Yes, and it was always.
Environment.
So I just feel that the fundamental thing is the existence of a virus. And if there is no virus, and I know that's really far out there for a lot of people, whether educated or not, and I'm not going to be unkind, but I think we really need to concentrate our efforts on talking about this rather than just forgetting about it. There's so much breaks my heart to the whole vaccine rollout, the kind of harm that was done to people, but the House of Cards could be brought down simply. It'll be a real cognitive dissonance yet again for people to sort of process that. But we have to go there.
Interesting.
You've actually just made the first point I was going to make about germ theory and terrain theory, which, I think probably, rather than there being no germs, I think there are probably millions of them all the time. And I think we're normally fighting them through our mucosal barriers, and we're just defeating them. So, because I get colds all the time, and just fight them off. I think this might just be a cold, but the second point I wanted to make was really to respond to the other, and it's quite a major kind of group of theories and thoughts, which is about the wider, bigger picture, the bigger context of kind of, the extent to which Bill Gates and WEF and so on, are planning a major kind of conspiracy to destroy humanity and so on, which I tend to actually look at World War One as the best analogy. Now, we know perfectly well that most normal people, walking around in 1914, did not want to go to war. So what actually happened? Well, what happened was mass formation. It was fear. Essentially, but it was driven and directed by the armaments industry. All these superpowers were gearing up for war. They were all saying, the other guy, he's got more guns than us. We need to build more guns. Oh, no, we'll build a Maginot Line and stop all their guns. We'll build more battleships. Then they'll build more battleships. So essentially what you had was a kind of human-like, lemming-like nature to actually ignore the fact that we were all driving each other over the cliff. Now, we've just seen today the death of Kissinger. I didn't like Kissinger very much, but he did, I think, possibly just hold us back from World War III. However, we don't know that. What I did do is I can say I protested against the bombing of Cambodia, which he initiated when I was a student. And I don't like Kissinger. I think he was a very evil, malign influence, but it's possible that he may have some people defending him. Nevertheless, the whole concept of a conspiracy is a complicated one for me to get my head around. I think human beings are not capable of great conspiracies. I think things like autism, I think things like the rise in diabetes type 1 are probably caused by the terrain that we're living in, rather than caused by somebody deliberately setting out to give lots of people autism or to give lots of people diabetes type 1. And I think that in COVID, it was quite clear all those giant tanks were rolling up on the lawns of every country in terms of there were a lot of people with a lot of stake in having an epidemic. They wanted a bloody epidemic. They actually wanted one. So when COVID came along, which is actually not a very good one, it's a pretty minor epidemic, as epidemics go, as pandemics go, they all jumped on it. And suddenly the media got terribly, terribly excited. So we saw all these horror stories, Chinese citizens falling down in the street and stuff like this, which was obviously faked. But I'm afraid that what happened was that mass hysteria just took over. Fear is a direct relationship to intelligence. If you increase the fear, what happens is the central part of the brain actually closes down to fear and gets rid of all the reason and the intellect. Yeah, so the brain closes down. And what we saw there was just as in World War One, all reason was lost. All reason fell by the board, and like lemmings, we just rushed onto that cliff. And that's my theory. It's not a conspiracy theory. I'm sorry. And it's not either a cock-up theory. It's a theory about human behaviour in crowds. And I've sat there in Hampden and I've watched the riots going on when football supporters fall out with each other when the game doesn't go their way. If you're ever in a big crowd, it's scary. It's very scary. So I'm wondering what you think about my crowd theory.
Yeah, I think there's an awful lot in that. And you're probably aware of Matthias Desmet's book, The Psychology of Totalitarianism?
No.
Oh, you should read that. And he's basically, he says in the book what you've just said. But he gives some of the the background to the development of the thinking, and Hannah Arendt was one of the first workers in this field. So he talks about her work. But yes, he says that there was a mass during the COVID pandemic. There was a mass formation, and I'm not sure that he refers to it as a mass formation psychosis, does he? Or he does, yeah. But there was a big group process which was going on, and people, if you like, lost their minds. And he talks about 30% of the population were perhaps in this, but a lot of them who were in this were in positions of power. And then there's a large percentage of the population who just go along with it. And then there's a relatively small group of people, dissidents, probably includes everyone in this room, otherwise you wouldn't be here. Dissidents, maybe 15, 20% who speak out against it. So it's a very good book, I'd recommend it. And one of the things he says is that it's very important that the dissidents do speak out. You feel sometimes that you're not having any impact, but you are, you're stopping it getting even worse. And there will come a time where perhaps others might listen to you. So some of the large percentage of people who just go along with it will begin to waver and agree and come over to our side, if you like, and see that there wasn't a terrible COVID pandemic, or nowhere near as bad as they said it was. and there isn't global warming, a catastrophe, a global emergency. So it's very important that groups like this continue to meet and debate these things and refuse to be silenced. But yeah, Matthias Desmet, he's a professor of psychology in Belgium. A recent book, about a year ago, it was published, The Psychology of Totalitarianism. Yeah.
So my question was just trying to get at, does the leadership, worse than not care about us? Do they actually mean us harm and are technically, we're at war with our own leadership? So my question is, to get to that, because of course our intelligence agencies do not trust China. Since when do we trust China and anything they tell us? Since when do we trust the World Health Organization, which is largely run by China, and our intelligence agencies and all that? We wouldn't take any advice from them if we were sensible, and we know this, and yet we appear to have. How long would it have taken for the public health to have rolled out a quick campaign of all sorts of vitamin regime and an exercise program, because they really care about us? How quickly could your colleagues have hit the televisions and the radios with a campaign and had free pickup at Boots and Lloyd's Pharmacy? Get your Scottish minerals. We've got vitamin D, vitamin C, and this nice selection for you. And it's patriotic because we give a shit about you and we want you to go and get some fresh air. Here's the basic advice. Let's all do it. Let's see who can run the furthest, and we'd compete about it and everything. How quickly could they have actually done something to help us? Or actually, is that completely naive and it would have taken 6 months? How quickly could they have helped us if they cared about us?
Well, it would have taken an awful lot less than the time it took to produce these vaccines, that's for sure.
How quickly could, because it seems a childish thing to suggest that you could have said to the people, listen, these things are so cheap compared to even perspex to separate us. And masks are so bloody expensive. And the vitamins, we could have consumed them or just washed them away. So these things, how quickly could the people of Britain or Scotland, let's say, be given vitamins and advice? Could it have been like a couple of weeks, or it could have been a few days?
Well, advice just requires, it can be done almost immediately, going on the airwaves. If there's a consensus from the people, some key people, that this needs to be done. The vitamin D, well, lots of factories produce that already. So it's out there, yeah. You can get high-dose vitamin D from Holland and Barrett and in most supermarkets.
So you could have tried that for a week at least.
Well,
so we're not going to do anything, we'll try this for a week.
The production of vitamin D, high-dose vitamin D, could have been ramped up quite quickly, I'm sure. So it would have taken, weeks or months to do that. So yes, this could have been done, but I think the problem was the forces that were stopping that, and that wouldn't even countenance that sort of advice. And the people who were in positions of power, in not so much the politicians, I think, initially, because I don't think they really knew what to do, but the medical and scientific establishment, the CMOs, the chief scientific advisors, the sages of this world, the JCVIs and MHRA, they didn't seem interested in the readily available and cheap potential solutions to this: vitamin D, ivermectin, hydroxychloroquine. And I'm sure there was a lot of influence, behind the scenes by pharmaceutical companies, because if ivermectin, hydroxychloroquine, and these primary care protocols for treating early COVID had been implemented, then the vaccines would not have been able to get emergency use authorization. They can only get emergency use authorization and curtail the years and years and years it takes to develop and test them. Well, they can only do that if there's no viable alternative effective treatment. So they had to rubbish ivermectin, hydroxychloroquine, etc. Otherwise they couldn't develop and sell the vaccines. So there was an influence there from the pharmaceutical company.
It sounds conclusive that they not only didn't care about us and don't care about us, but they actively meant us harm. And they're the same people, because none of them have been removed and none of them have been prosecuted. So the people who are running this and will run the next pandemic, they mean us harm. They've clearly proven they don't care about us, because all your advice was thrown in the bin. Everything that was invested in and talked about and studied was thrown in the bin, and lots of cheap solutions. Let's go cheap. We're Scots. Let's go cheap. We could have gone cheap.
We could.
But we didn't.
Cheap and effective.
They didn't.
Cheap and effective and no side effects. But we didn't. We didn't.
Hi, thanks a lot, Alan, for a great talk. We've talked about excess deaths, or you talked about excess deaths. So obviously there's been a bit of debate as to what the cause was in 2020 and 2021 as to whether it was caused by a pandemic. If it wasn't caused by a pandemic, then it was caused by something else. Because we did have the excess deaths. Now, one thing that you mentioned is that if we just go with the narrative that it was caused by a pandemic, even if it wasn't caused by a pandemic, if you have high excess deaths for a couple of years, then you pointed out that after that you'd expect the death rate to fall, because if you take, for example, January and February 2022, people that would have otherwise been destined to die at that point had already died.
Yeah, exactly.
In 2021 and 2020.
Yeah, exactly.
So my question is that the UK had one of the highest excess deaths. So do you think I would be right in saying that when you see the trough that comes after the pandemic or after the cause of the deaths, when you see the trough, that you'd expect the trough in the UK to be deeper because the excess deaths were higher?
Yeah.
Is that?
Yeah. That makes sense. Yes, I would expect that.
Okay.
I would expect that, but we haven't seen it, have we?
Well, this is the thing, is that a bit like yourself, I've been downloading spreadsheets of death data from the ONS website for a couple of years now, almost 2 years, and so there is actually some data that shows that there was a reduction in deaths in the UK, and it hasn't been published.
This was in 22, 23?
22, January, February, March and April 2022. There was negative excess deaths in England and Wales. And now the point being is that I've published the data and I posted it to every MP in the UK. I'll give you a copy of what I sent to all the MPs. But the significance of the fact that there was actually fewer people dying in January, February, March and April 2022 compared to the pre-pandemic 5-year average, that's significant for several reasons, because you'd expect over that period, you'd expect deaths to be increasing for two reasons, because the population's getting older and the population's getting bigger, but there was a reduction, and it's in line with the fact that we had excess deaths. So that is what happened in January to April 2022 is kind of what you expected.
Yes.
And that's why I think that specific data is so important, because my next question is, how long would you expect that effect to last?
Well, you can see it. You can see it on here. You can see that the blue line is the UK.
Yeah.
And there's a point there. It says in the middle, March. Should I see if I can point to it?
So what you're saying, you can see it there.
Yeah, you can see the data you're talking about there. So just above here, that says March 31st, 2022.
Yeah.
And if you go up, you can see the blue line flat lines
Yeah.
or goes down slightly.
Yeah.
So you're right. I mean, through 2022 and 2023, it wasn't excess every week, every month.
Yeah.
And that period, as you say, it went down, but then it went back up.
Yeah.
So just by random chance, you get variation in mortality week by week, month by month. So you're right, but there's a longer term trend there,
Yeah.
which is unexplained.
Well, that's right. But the point that I wanted to make is that the long-term trend is kind of like made even worse by the fact that you've got the effect, the post-pandemic effect of there's something causing deaths to drop, right? Because
Yes.
people. So there's this. Because what you see there
Yes.
is a combination of 3 or 4 different things that are all happening.
Yes, you're
So
right.
there's some
You're
things
right.
that are increasing death, there's some things
Yes.
that are reducing death. And the point I'm trying to make is that data is far more significant than what it looks like, because
Yes.
in all of these countries that had excess deaths in 2020 and 2021, there was a force at play that was significantly reducing deaths from the people who should have died but died earlier.
Yes.
Right? And
Yes.
that effect is being completely negated, and some
Yes,
more.
you're right.
Which basically makes this data even more significant.
You're dead right. So, for example, over the 22-23 period, on average, we've been seeing about, in the UK, about 1,000 deaths, excess deaths a week, based upon the 5-year average from 2014 to 2019, pre-pandemic years. And what you're saying is that it actually is higher than that, because what we should be seeing is a dip in that blue line. So it might be actually 1,500 or 2,000 excess deaths we are really seeing. But you're right, part of that, the real excess deaths, is sort of invisible, if you like. We're taking it to a baseline. We're not counting those other ones you're pointing out. So you're dead right. The excess deaths we're counting doesn't do justice to the real figure. So there's something very badly going wrong here. And the other thing to say about these excess deaths in 22-23 is that, whereas the deaths in 2020 and 2021, the average age of death in those excess deaths, those COVID deaths anyway, was about 82 point something. So above the average life expectancy. These were elderly people with a lot of health problems who were dying, and they were, in reality, probably dying maybe a year or 2 earlier than they otherwise would. A lot of the people dying now in 22-23 are middle-aged. So the number of years of life lost is far, far bigger. So we have athletes dropping dead with heart attacks, and 40, 50-year-olds dying. So, that's another way in which the impact of these current excess deaths is far, far worse. And the impact on society, on families, on children is far greater. So, it's very bad, and it's just amazing that the authorities aren't interested in investigating this, finding out what is causing it, and doing something about it.
Thank you very much.
Thanks.
Just to build on that, just within that, and you mentioned the sources, but Public Health Scotland's very good as well. National Records of Scotland, and it's good to look at the categories, the classifications of deaths, and what is it, as the international disease classification or something.
ICD-11 we're on now.
So we've got to break it down and see what people are dying of, whether it's cardiovascular, cancers. Cancers is always still high, cardiovascular still high, and then later on the World Health Organization gave COVID its own code. So COVID previously was under respiratory stuff, and that's very interesting, because there's something very interesting there, because before COVID got its own classification, it would come under respiratory illness. And look at the statistics for that from the beginning of 2020 going on. Some respiratory deaths fell
Yes, they did.
which was very strange. That's the first thing I noticed.
Yes, they did.
That although you remember the first panic about COVID was pneumonia and the ventilators. Oh, we need ventilators. We can't get ventilators. And then they went, oh, hang on a minute. No, it's not ventilators. We need to put people on their front. Remember that? It all changed. It was always changing all the time. But what I noticed was, I thought, what the hell's going on here? Because I say, remember, COVID back then did not have its own disease classification, and it's something like JC something, if I remember right.
Yeah.
If it's got a
Yeah.
code. So it's all under respiratory illness. So people were really getting respiratory illness, beyond the normal limit. Why the hell was the deaths from that classification falling? It was very strange. Something's not right. As I say, there's lots to unpick.
Yeah.
If you look at the data, it's very interesting.
Yeah.
Look at the different classification of diseases that people are dying from. That's what we need to look at.
Yeah.
But that's what they're not doing. They're deliberately not doing that. And also interesting is now, in Public Health Scotland and things like that, you can't get COVID stats now because they're buried within. They're back to being buried within the respiratory illness. It's very clever what they've done. Do you see what I mean? They've woven it back in again because it's kind of saying, oh, well, we don't test for COVID now, blah, blah, blah. Just go on about your business. But yet people saying, oh, COVID, there was an email today in the NHS about, or something today about COVID panic again. But you can't get absolute stats on COVID now, probably because they've been so low. They're falling.
Yeah.
But they've woven them now into back into respiratory illness again with flu, which is very interesting. And yes, flu disappeared, and I've got stats on that, and then it went back up at the beginning of this year. So look, the devil is in the detail, as they say. Look at how things are classified, and it's all out there. You can find it if you just go out and look for it.
Yeah.
But there's been some very shady things going on, because I've been watching it, the way that they've, on vaccination stats and deaths, and all of a sudden you can't find that page.
Sure. Yeah,
You know
data.
what I mean? It's very strange.
Data disappear, and
There's hidden data there.
they stop producing it if it's not following the preferred narrative.
It's like a collusion. It's like you say, public health people have been colluding in this for God knows why.
No.
Okay, well, I think we've been giving you a real thorough going. And you stood up to it
the nicest possible way.
magnificently. I think your presentation was fantastic. Just saying what we should have done and what we actually did, and putting those two things, juxtaposing those two things, just makes it so clear of what was going on. So thank you very much indeed for a wonderful talk.